So from today onwards, we learn about the nerves of the lower limb, right? We are done with the arteries and we are done with the venous system. We have to discuss about the nerves and lymphatic drainage, right? So nerves of the lower limb. So nerves of the lower limb came from the lumbar plexus, right? Plexus means network, okay? An intricate network, right? So there are networks of nerves in the lumbar system and in the sacrum system. It is called as lumbar plexus and it is called as sacral plexus. Together they are called as lumbosacral plexus, from which all the nerves of the lower limb derives. Okay. So you see, the lumbar plexus is formed by the anterior rami of the nerves of L1 to L3. Okay, you have to remember that this. Okay, you have to know this by your heart. Okay, from L1 to L3. Okay, anterior rami of L1 to L3 and upper L4. Okay, most of the anterior rami of L4. Okay, from with this. Okay, L1 to, you see this one, and this one. Okay. So this network is called as lumbar plexus, right? So from these plexus, okay, these nerve roots, okay, rami, okay, you see this is the obturator nerve, okay, you know that femoral nerve, lateral cutaneous nerve of the thigh. Okay, so these are the nerves of the lower limb, right? So these formed by the L1, L2, L3 and upper part of L4. Okay. It also receives a contribution from T12 or subcostal nerve. Okay, a slight, just lower, very just a twig. We call it a twig of nerve. Okay, you have to remember anterior rami of L1 to L3. Okay, in order to understand what is rami, you have to know the anatomy of the cross section of the spinal cord and how the spinal nerves are formed together. Okay, from the spinal cord itself. Okay. Actually, this is a topic in the physiology. You will know more about that in the physiology, but let me give you a cursory view of things. Okay, this is the cross section of the spinal cord. Okay, this one is the spinal cord. Okay, this is the white matter. Here it is given. Okay, remaining thing is gray matter. You see, this is the gray matter from which nerve cells originates. Okay, so this is the posterior and this one is anterior. Okay, so these are called as horns, right? So this is called as dorsal horn, right? Because it is on the dorsal side, and this is called as ventral horn, right? Because this is on the ventral aspect or anterior aspect. So basically the cells from the anterior horn or ventral horn, right? So this is called as root. Okay, nerve root. Okay, this one is also called as root. Okay, so you see this is the dorsal root and ventral root. Okay, so these roots formed, okay, to form the spinal nerve. Okay, which exits the Okay. So the spinal nerve again divides as a branch. Okay, it is called as ramus. Okay, and plural is rami. Somebody is waiting. Sorry. Plural is rami. So this is a dorsal rami, and this is ventral rami. Right. So you see. Ventral root and dorsal root. Okay, ventral rami, see, and dorsal rami. Okay, dorsal, ventral. Okay, two. So these nerves supplies the muscles. Okay, basing on their position. Okay, whether they are from dorsal rami or ventral rami, or whether they are from anterior horn or posterior horn, they are either sensory or motor. Okay, so again this is more. So this one is ventral root, and this one is dorsal root. Okay, this one is dorsal rami, this one is ventral rami. Okay, so this one is the spinal cord. Okay, this one again gives some more perspective. Okay, you see these are the roots. Okay, ventral root, dorsal root. Okay, and this is the spinal nerve. Okay, spinal nerve again divides as dorsal rami and ventral rami. Okay, this is the ventral rami. Okay, so that is the basic structure. So that is how the lumbar plexus forms. Okay, this is a universal cross section of the spinal cord, and this is how the spinal nerves and spinal roots formed, rami are formed. But when we are speaking talking about the lumbar plexus, this is how lumbar plexus forms from L1, for example. Okay, L1, L2, L3, L4. Okay, L1 to L3 anterior rami or dorsal ramus of L1 to L3. Okay, so let me, okay, we'll see that. Where is this? Okay, you see, so this is the, you see, this is the L1 to lumbar plexus is formed by L1 to L3. This one is the L2. Okay, okay, so this one is the L1, right? L1 vertebra, L2 vertebra, L2, L3 and L4, and the L1 comes from the between foramina, intervertebral foramina between L1 and L2. Okay, at the junction of L1 and L2 intervertebral disc. Okay, this one is the L1 spinal nerve. Okay, okay, let's remove this. Okay, so 1 minute, please wait. Okay, so you see, sorry. So this is the spinal cord. Okay, okay, so this is the spinal nerve. Okay, this is the dorsal rami, and this one is the dorsal root, this one is the ventral root. Okay, so That is how they are formed and giving to the spinal nerve. Okay, this is the L1 spinal nerve, L2 spinal nerve. Okay, I think you are getting it. Okay, so these lumbar vertebra. Okay, this is L2, L3, L1, L2, L3, L4, L5. These are lumbar, and this is the sacrum. Okay, and the nerve roots coming from this. Okay, are called forms sacral plexus, right? So the upper part of the L4 participates in the lumbar plexus, right? Whereas the lower part participates in the I'm sorry. You see, so uh, so this network is called as lumbar network. Upper network is this one is the lumbar network. Okay, lumbar plexus. This one is the sacral plexus, right? So sacral plexus. So if you observe, okay, that is sorry, okay, that is L4, okay, L4 and L5, okay. Lower part of L4, you see, this is the L4, right? That is L4 vertebra, this is L4 spinal nerve, and so I'm sorry, okay. Lower part of the L4 and L5 are called as lumbosacral trunk, which participates in the sacral plexus, right? Right? Hope you are getting it, right? So from the ventral and dorsal rami comes all the way, they formed as spinal nerves. Okay, this is the lateral femoral cutaneous nerve, and this is the femoral nerve, right? So they originates from lumbar plexus, right? Okay, so the branches of, we'll have a cursory view of lumbar plexus, and then we'll discuss in detail the nerves of the lower limb. Okay, branches of the lumbar plexus include iliohypogastric, ilioinguinal, and genitofemoral nerves, the lateral cutaneous nerve of the thigh, femoral and obturator nerves. Okay, the lumbar plexus forms in the substance of the psoas major muscle. Okay, so everything is related with the psoas major muscle. That is why uh, you see this one is the psoas major muscle. Okay, this one, you see. So the lumbar plexus forms in the okay, substance of psoas major muscle, right? Muscle anterior nerve of the thigh to its attachment to the transverse process of the lumbar vertebrae, right? Therefore, the relative to the psoas major muscle, the various branches emerge either anterior, or genitofemoral nerve is anterior to the psoas major, and obturator nerve is medial to the psoas major. Okay, iliohypogastric, ilioinguinal, and femoral nerve. The lateral cutaneous nerve is lateral. Okay, we have to remember these things. And you see, so this one is the sacral plexus, right? Sacral plexus. Okay, so L4 and L5, right? This is L4 and L5 participating in sacral plexus called as lumbosacral trunk. Okay, so you see, this is the femoral nerve. Okay, femoral nerve. Okay, L1 anterior rami, L2 anterior rami, L3 anterior rami. So these rami, okay, forms as intricate structures, intricate plexus, right? Ilioinguinal, lateral cutaneous nerve of the thigh. This one is lateral cutaneous nerve of the thigh. Genitofemoral nerve, obturator nerve. Okay, see, again with the muscles. Okay, you see, this is the obturator nerve. Okay, this one is thickest thick one is femoral nerve. Again, lateral to the anterior superior iliac spine is femoral cutaneous nerve of the thigh. One is iliohypogastric and ilioinguinal nerves. Okay. So this is the psoas major, right? Genitofemoral nerve is anterior to the psoas major, right? And ilioinguinal is femoral, femoral cutaneous. All these are lateral, right? So this is the lumbar plexus and this is the sacral plexus. So this L4, L5 participating in the sacral plexus is called as lumbosacral trunk. Okay. Coming to the a brief view of the branches. Okay, though they don't pertains to the lower limb. Okay, the iliohypogastric and ilioinguinal nerves. Okay, they came from L1, arises from L1. Iliohypogastric and ilioinguinal nerves arise as a single trunk from the anterior rami of L1, either before or soon after emerging from the lateral border of the psoas major muscle. This single trunk divides into the iliohypogastric and ilioinguinal nerves, right? Iliohypogastric nerve. This iliohypogastric nerve passes across the anterior surface of the quadratus lumborum muscle, that is the back muscle, right? Posterior to the kidney. It pierces the transverse abdominis muscle and continues anteriorly around the body between the transverse abdominis and internal oblique muscles. You will be confused by this data, but anyhow you have to expose to this. Okay, later when we discuss when we deal with the back and abdomen, you will be illuminated more, right? Above the iliac crest, a lateral cutaneous branch pierces the internal and external oblique muscles to supply the posterolateral gluteal skin, right? This one is the iliohypogastric nerve. Okay, same trunk. Okay, divides, right? The remaining part of the iliohypogastric nerve, anterocutaneous branch, continues in an anterior direction, piercing the internal oblique just medial to the anterior superior iliac spine as it continues in an oblique downward and medial direction, becoming cutaneous just above the superficial inguinal ring. Okay, after piercing the upper nearest of the external oblique, it distributes the skin in the pubic region. That is why knowing these things is important. Throughout its course, it also up to branch of the abdominal musculature. So this is iliohypogastric. Coming to the ilioinguinal, smaller than and inferior to the iliohypogastric nerve, and it crosses the quadratus lumborum muscle, goes more oblique than of hypogastric. Usually crosses part of iliac muscle on its way to the iliac crest. Near the anterior end of the iliac crest, it pierces the transverse abdominis muscle and then pierces the internal oblique muscle and enters the inguinal canal. Right? So indirectly all have connection with the lower limb. Ilioinguinal emerges through the superficial inguinal ring, right, along with the spermatic cord, and provides cutaneous innervation to the upper medial thigh, root of the penis, anterior surface of the scrotum in men, or the mons pubis and labium majus in women. Okay, so remember that it also supplies abdominal musculature. So same iliohypogastric, that is iliohypogastric, and this is ilioinguinal, right? You see, it is supplying the thigh and scrotum and root of penis, right? And labia majus and mons pubis in the female. Genitofemoral nerve, roots are L1 and L2. Genitofemoral nerve arises from the anterior rami of L1 and L2. It passes downwards in substance of psoas major muscle until it emerges on the anterior surface of the psoas major. It then descends on the surface of the muscle in a retroperitoneal position, passing posterior to the ureter. It eventually divides into genital branch and femoral branch, right? Femoral branch descends on the lateral side of the external iliac artery, passes posterior to the inguinal ligament, entering the femoral sheath lateral to the femoral artery. Okay. Pieces anterior layer of femoral sheath, and fascia lata to the skin of the upper anterior thigh. Skin of the upper anterior thigh is supplied by genitofemoral nerve. Okay, femoral branch of you see, this is the femoral branch, and this one is the genital branch. This is the genitofemoral nerve. See, L1 from L1 and L2. Okay, so, one branch applies this. You see, where is this one? See, this is the genitofemoral nerve, right? These are the branches supplying the thigh and external genitalia. And these are the, you have to remember this picture, because as far as the lower limb is concerned, you have to know the cutaneous supply of the upper thigh, right, along with the inguinal region. You see, this is the ilioinguinal nerve. Okay, it supplies there. Iliohypogastric nerve, lateral cutaneous, anterocutaneous, genitofemoral nerve. Okay, coming and supplying this part. Okay, genitofemoral nerve. This part is by okay. This is one part. This is, you have to remember those parts. Okay. Again, genitofemoral nerve part, ilioinguinal nerve. Okay. Operator nerve. Okay, we will discuss that in detail later. Coming to the lateral femoral cutaneous nerve. Okay, we have, so we came to the nerves of the lower limb. Lateral femoral cutaneous nerve. The lateral femoral cutaneous nerve or lateral cutaneous nerve of the thigh. Lateral cutaneous nerve of the thigh, right, arises from the dorsal branch of the second and third L2, L3, right, ventral rami, and emerges from the lateral border of the psoas major, crossing iliacus obliquely towards the anterior superior iliac spine. It supplies the parietal peritoneum in the iliac fossa. Okay, you see, this is the lateral cutaneous nerve of the thigh. Okay, from L1 to L2, L3. See, L2 and L3. Okay, right. So this lateral cutaneous nerve of the thigh supplies the cutaneous part of upper and lateral thigh, right? So this is the distribution. This is its distribution, right? It supplies the skin of that part. Okay. So whenever you have to remember these things. Okay. Femoral cutaneous nerve of the thigh or lateral cutaneous nerve of the thigh. Okay. So whenever somebody complain tingling or numbness only on this region, you have to think of this nerve and think of those roots. Okay, L2, L3. Okay, this is very important. The nerve passes posterolateral to the cecum, separated from it by the fascia iliaca and peritoneum. The right one. Okay, right one is related to the cecum and peritoneum. Left one passes behind the lower part of the descending colon. Right. Then both pass behind or through the inguinal ligament, variably medial to the anterior superior iliac spine. Okay, commonly 1 centimeter. Okay, this is very important. And anterior or through sartorius into the thigh, where they divide into anterior and posterior branches, right? So the anterior branch becomes superficial, approximately 10 centimeter distal to the anterior superior iliac spine, and supplies the skin of the anterior lateral thigh as far distally as the knee. Okay, remember that. Okay, as far as the knee, right? So all of this is lateral cutaneous nerve. Okay, as the knee. It connects terminally with the cutaneous branches of the anterior division of the femoral nerve. Okay, cutaneous branch of anterior cutaneous branch of femoral nerve, right? You remember the schematic diagram of the cutaneous nerves of the thigh, okay, which were shown in during dissection, right? Femoral nerve and infrapatellar branch of the saphenous nerve, okay, forming the peripatellar plexus. Okay, remember that. The posterior branch reaches the fascia lata higher than the anterior and divides to supply the skin on the lateral surface of the greater trochanter to about mid thigh. Okay, greater trochanter. It may also supply the skin of the gluteal region. Okay, this is the, you see, lateral cutaneous nerve of the thigh. Okay, this is the anterior superior iliac spine, just 1 centimeter, and this is fascia lata, piercing the fascia lata, it supplies. Okay, so this is the area. Coming to the clinical aspects, lateral femoral cutaneous nerve may become entrapped at 3 sites along its course. Okay, close to the vertebral column, within the abdominal cavity as the nerve travel across the pelvis. Okay, this is the third part, second part, and as it leaves the pelvis, that is at the inguinal ligament. This site where the nerve is most commonly damaged and entrapment is throughout to occur as the nerve passes through or deep to the inguinal ligament just medial to the anterior superior iliac spine. So that is the most commonly entrapped and damaged. The angulation of the nerve as it crosses the iliac crest means that it is vulnerable to compression during movement, right? Hip extension may increase angulation and tension of the nerve. Injury produces an area of impaired sensation, often with pain and paresthesia on the anterolateral aspect of the thigh. So it is called as meralgia paresthesia. Okay, meralgia paresthetica. Meralgia paresthetica means anterolateral side of aspect of the thigh. Okay, tingling and numbness associated with pain is called as meralgia paresthetica. Okay, symptoms may be exacerbated when wearing tight belts or tight waisted clothes or as a result of a recent weight gain or pregnancy, right? The posterior branch of the lateral femoral cutaneous nerve, which supplies a thin strip from the greater trochanter of the femur down about 2/3 of the way to the knee, may be affected separately. This branch leaves the main trunk of the nerve, usually distal to the inguinal ligament, and it then turns laterally to pierce transverse fascia lata, where it may become entrapped. Okay, so this is the schematic diagram. Okay, we learned during dissection. So this is the lateral cutaneous nerve of the thigh. Okay, anterior branches. These are the anterior cutaneous branch of the femoral nerve. So this connects with this. Okay, in this area. Okay, let's see the 3D anatomy. Okay. Please wait. We are running out of the time. Femoral cutaneous. Where is that? Where is the view? Okay. You see, that is the lateral cutaneous nerve of the thigh, right? Okay, you see, this is just how it is anterior. This is the anterior superior iliac spine, how it is emerging, right? So that is where it is mostly entrapped, okay, from the inguinal ligament, right? Okay, so that is the femoral lateral femoral cutaneous nerve of the thigh, okay, and this is how it is related. So the selected one is femoral cutaneous nerve of the thigh, right? You see, so femoral cutaneous nerve of the thigh. So this is entrapped at that position. Whenever that is entrapped at that position, the whole area, okay, the whole of it will be tingling, numbness and pain, okay. So tensor fasciae lata, anterior and lateral aspect of the thigh, right? So this is the femoral cutaneous nerve of the thigh, okay. This is the femoral nerve, okay. There is a difference, and femoral cutaneous nerve of the thigh root is L2 and L3, right? This is the thing, okay. This is how, okay. See, as major, this is as major, okay. This is the lateral femoral cutaneous nerve, right? This one is iliacus, right? So that is how it is related, right? You see, from L2 and L3, okay. Roots are from L2 and L3, right? Okay, that's all we got today, right? Have any doubts, let me know, okay. If you have any doubts, okay. Okay, follow the class and closely observe the lumbar plexus, okay. Today you go through the lumbar plexus and its different branches, right? Okay.